In our medical news this morning, more Americans are surviving cancer. That is the word from the American Cancer Society. 75% of Americans with cancer are alive at least 5 years after their initial diagnosis. That's up from 50% in the 70s. So what's driving it? They say fewer people smoking, earlier detection, and improved treatments. And opting out of childhood vaccines is becoming more common. JAMA shows that since COVID, non-medical vaccine exemptions have risen to 3%. Medical experts say growing clusters of unvaccinated children could drive future outbreaks. And respiratory virus season in full swing. Health experts say we likely haven't reached the peak quite yet. Mandy Gaither goes over symptoms and why it's important to know which illness you have.
Across the U.S., respiratory illness is high. Seasonal flu remains elevated, as is RSV, with activity in many parts of the country and emergency room visits and hospitalizations increasing among children 0 to 4 years old. COVID-19 activity is currently low, but is increasing nationally.
Every year, there is a dance of respiratory viruses.
Dr. Frank Esper with Cleveland Clinic Children says all of these seasonal illnesses have similar symptoms. So when you're sick, it can be hard to know which you have. For flu, the two main types circulating are A and B. Flu A tends to be more severe with high fever, shakes, and chills, and more gastrointestinal issues, especially in children. He says adults usually have more of a cough. Symptoms for RSV include runny nose, congestion, decreased appetite, coughing, sneezing, fever, and wheezing.
It really causes problems if you have underlying lung disease, especially things like asthma or COPD, or are prone to have wheezing.
Symptoms for COVID-19 may include high fever, muscle aches, and stomach aches.
If it gets into your lungs, it can cause a really bad pneumonia.
If you're sick, Esper says it's important to be tested to know which virus you have because treating it early is key.
Viruses, once that ball gets rolling, it's very difficult to stop, even with an antiviral medicine.
The CDC says if you have emergency warning signs like trouble breathing or chest pain, you should seek medical care immediately.